in New Jersey, we're proud of many things: our beautiful shoreline, Bruce Springsteen, and the richly diverse group of people that call this state home. We're also proud of how our healthcare community has worked to improve the quality of care coordination, which in turn has positively impacted the transitions of care that our patients and families experience. This hasn't been an easy task, but through our efforts, New Jersey hospitals have seen significant improvements in patient outcomes, including sharp reductions in preventable readmissions. Factors that negatively impact transitions of care include lack of access to language services, inadequate community and healthcare coordination, and social determinants of health. We use several approaches dedicated to making transitions between care settings as successful as possible. New Jersey may be one of the smallest states, but it's also one of the most diverse, with 22% of its population born outside the U.S. Communicating with people with limited English proficiency is a significant challenge faced by healthcare professionals working with such diverse patients. Language barriers can negatively affect access to care, the quality of care patients receive, and the ability to understand and adhere to recommended treatment and discharge instructions. For New Jersey in particular, this has shown significantly higher rates of healthcare-acquired conditions such as sepsis, severe maternal complications, and preventable readmissions. One strategy we use to combat these issues is bilingual clinical staff. We provide a robust training program aimed at empowering interpreters to be more effective and culturally sensitive in their role. We offer this course 6 times a year with training locations around our state. We make it easy and accessible for healthcare staff to participate. We are proud to say that we have trained more than 1,500 individuals that have gone on to be part of healthcare teams improving the care and outcomes for patients. Another thing we find essential to our efforts is reaching the people who make an impact on the patient's health from the moment they leave the hospital. We partner with our quality improvement organization, Healthcare Quality Strategies, Inc., to form a care coordination community coalition. The coalition brings experts in acute care, post-acute care, and the community together to discuss issues around transitions of care, including sharing information effectively across care settings. Learning from varied perspectives helps us better understand the barriers to achieving higher quality of care. Addressing social determinants of health is increasingly critical to improving care transition outcomes. One of our more unique programs involves military veterans trained as healthcare navigators to serve uninsured and newly insured residents of some of our more socioeconomically challenged counties. With their military backgrounds, they truly aim to serve, and their commitment, dedication, and drive to improve care is remarkable. Our veteran navigators are specially trained to identify and assist patients and families with accessing care, as well as resources such as housing, transportation, and food. Our team of navigators have worked with more than 1,500 patients. We know that if care is not coordinated thoughtfully, patients may not receive the best care possible, or even worse, may suffer harm. That's why improving care coordination and the transitions of care is a priority for us, and why we remain committed to doing this work.